I'm Dr. Sam Goldhaber, President of NATF, and I would like to talk with you about our NATF initiative in stroke prevention of atrial fibrillation. Stroke is a major cause of cardiovascular death in the United States. It accounts for about 15% of all cardiovascular deaths, and it's the second leading cause of death after heart attack. This NATF initiative is set up to figure out how we can best prevent death and disability from stroke, and in fact how we can best prevent stroke for those strokes that are preventable. Many of the strokes that are preventable are due to the cardiologic condition called atrial fibrillation, when the atrial chambers of the heart are not beating in a regular fashion, and blood clots can form and hide in the atria and then periodically be expelled. And when they get expelled out of the heart from the atria, they tend to go north to the brain and cause a stroke. It can be a devastating stroke, one that causes permanent neurological disability, or it can be a fatal stroke. In general, strokes due to atrial fibrillation are much more disabling and are more often fatal than average run-of-the-mill strokes, and we have many important new tools on how we can assess the risk of developing a stroke from atrial fibrillation. These include clinical factors such as whether there is underlying hypertension or diabetes or congestive heart failure. Women with atrial fibrillation are more susceptible to stroke than men. And we also have an exciting new field of certain blood tests that are called cardiac biomarkers that can help predict the risk of stroke in people who have atrial fibrillation. And some of the biomarkers that have been looked at include troponin levels and brain natriuretic peptide, and also markers of inflammation such as C-reactive protein. What we've done at NATF now for the past year and a half is assembled a world-class faculty to come to consensus on what steps we should take. This is an urgent problem that we're facing. It requires not only clinical expertise, but it includes public advocacy so that the public has access to the newest and best available anticoagulants to prevent stroke. So I hope you will be able to study up on the deliberations from the NATF Atrial Fibrillation Initiative, and that you too will become involved.